A lot of it depends on what the cause of the heart failure is, how old the patient is. We certainly have made an impact on survival, a favorable impact on survival. So there are patients who have rather reversible forms of heart failure. You treat their underlying coronary disease or their valvular disease and take them out of heart failure, and they may very well do well for a long term and not die from heart failure. If you're a young person who has a cardiomyopathy and you respond really well to treatment, it's very difficult to say because we treat those patients very differently now than we did 15 or 20 years ago. And as I tell patients, I don't have to keep them going forever, just till the next best thing comes along. But if you don't respond well to current therapies, then there is a possibility that those patients are going to need advanced therapies. It might be transplant, it might be mechanical pumps, but we still have tremendous options available to us before we get to those very advanced therapies. I mean, there's no question that our lifestyle, the average American lifestyle that you describe, adversely impacts health. It puts you at increased risk for diabetes, for hypertension, for coronary artery disease. And as a result, we end up with these end-stage problems. From my perspective, I think it would be much better. You know, we really need to emphasize leading a healthy lifestyle. There is no question the best way to prevent or to treat the problem that I deal with, the problem of heart failure, is to prevent it. And there are many, many ways to prevent heart failure. Healthy lifestyle, avoiding things that increase your risk factors for coronary disease. Hypertension is a very common problem, but hypertension left untreated is one of the most common causes of heart failure in the United States, particularly among African Americans. But if you treat hypertension aggressively, you prevent patients from developing heart failure. And so prevention is far easier than treatment of this condition. You know, lifestyle modification is a challenge. People need to be motivated. People need to see a reason why often, unfortunately. Unfortunately, in my business, it's often the development of the disease that we'd rather prevent that motivates patients to change their lifestyle. I think anything that we can do to help motivate people to have a healthier lifestyle would be helpful. Obviously, smoking is a great example of that. There's still far too many smokers. It's remarkable how many times patients will come to me, they've got cardiovascular disease, they're taking their prescribed medicines, and they say, well, doc, you know, what other pill can I take? Can I take another vitamin? Can I take an herb? Can I take a supplement? And it's like, well, are you smoking? And it's like, well, yeah, I'm still smoking. It's like the number one thing that a person can do. So it's very, very challenging. And how to modify those behaviors is something that we really need to try to figure out how to do. I think we need to educate people about healthier eating. And I think although it's not necessarily industry's responsibility to fix all of these problems, they could certainly help us by providing healthier choices and for people. I think seeing a cardiologist is a very reasonable thing. I think, again, the average heart failure patient can be well cared for by a very good cardiologist. I think the flags for when to think about referring are A, if you don't respond to appropriate therapies. I think another flag is if you have one of the more unusual causes of heart failure. If it's not some of the more straightforward routine etiologies, then I think it's time to perhaps get another opinion. I would add that there's never a wrong time to get a second opinion. Getting your care doesn't mean that getting your care in a particular spot doesn't mean that you can't get a second opinion. And I think often we can provide a lot of reassurance. When patients come to see us for a second opinion, we can look over things, we can confirm diagnoses. If there are questions or concerns, we can help clarify those. So I think a person who has significant heart failure can certainly benefit from a second opinion almost universally, if they have the option of being able to do that. But I would say if patients respond to treatment, do well, then they can be cared for in their community.